Today, it's an honor for me to present a brief overview of NCD situation in Fiji. What are non-communicable diseases? These are basically, as you can see in the illness tree, these are basically conditions such as heart disease, cancer, mental health, accidents, injuries, and stroke. And as you can see at the bottom, those are some contributing factors such as eating junk foods, smoking, alcohol, physical inactivity, abuse, stress, and worries. These are some risk factors of non-communicable diseases. It can be either genetics, environmental factors, socio-demographic factors, factors of self-management such as tobacco use, alcohol, and basically what we eat. Factors of medical conditions. Fiji context. NCDs account for an estimated 84% of premature deaths in Fiji. It has become a socio-economic burden to the country. An emphasis must be placed on primordial prevention, enhancing wellness into our community rather than crisis management approaches which only focus on NCD control and strengthening resilience to disasters and pandemics. Why are NCDs so high in Fiji? Lack of physical activity, poor unbalanced diets, abuse of tobacco and alcohol, and basically environmental factors such as emissions. This is the report from the STEP survey 2011. 66.9% of our people were obese and overweight. 14.4% of our population had raised fasting blood sugars. 31% of our people had raised blood pressure, 30.6% of our people had taken alcohol, 85% of our people ate less than 5 combined servings of fruits and vegetables in a day. 16.6% of people smoked daily. This is basically just a graphic representation of the total special outpatients seen at public health facilities from the years 2013 to 2019. As you can see that the numbers keep increasing as the year progresses. These are some common cardiovascular conditions. The basic main ones are congestive heart failure, acute myocardial infarction, unstable angina. This is just a brief overview of injuries data. These are some of the estimated deaths. So the first main 3 common ones are road injury, self-harm, drowning. I have not elaborated much of mental health, but as you can see, self-harm is the second leading cause, deaths as well. Premature and mortality rates. These are the premature deaths. As you can see, people are dying young, below the ages of 60. Nutritional status. This is our Nutritional Survey 2014 report. As you can see, in the past 10 years, we have had children who are less than 5 years who were, the red highlighted is the changes that have increased, like wasting, underweight, and anemia. It has increased for the children less than 5 years, as well as for 5 to 14 years. School children 15 to 17 years, overweight, obesity, and anemia is a common problem, and it has increased. Similarly, for the adults and women of childbearing age, there's macronutrient nutrition deficiencies present. As you can see, for dental caries, this is obtained from the school tabular reports. So from 2013 to 2019, those were the highest rate of dental caries present in our school students, ranging from 14 to 18% of the total population screen. And for we also conducted rheumatic heart disease screening. Out of the population screen, 1.7% overall had detected heart murmurs. Where should be Fiji heading for the global targets? We want to establish 80% of affordable technology and medicine. 50% of people receive preventative therapy, halt the rise in diabetes and obesity, 30% reduction in salt intake, 10% reduction in harmful use of alcohol, and 25% reduction in premature deaths of people aged 30 to 70, 10% reduction in prevalence of insufficient physical activity, 30% reduction in tobacco use, 25% reduction in prevalence of high blood pressure. The value of preventing and controlling NCDs: we get more money for health, it boosts the GDP, increased workforce participation, reduced healthcare expenditure, people become healthier, increased life expectancy, and increased earning capacity, together with protection from financial risk of NCDs. These are the 16 best buy interventions for NCD prevention and control. We have so it's categorized under 4 main subtopics, which we have tobacco, alcohol, diet, physical inactivity, cancer, and cardiovascular diseases. For NCDs, SDG goal 3.4 is to reduce premature deaths of NCDs. It says here we can save 8.2 million lives by 2030 by implementing the WHO best buys for non-communicable diseases. Every US dollar invested in the WHO best buys to tackle non-communicable disease will yield a return of at least US $7 by 2030. Just a quick elaborate on the pillar and action tracks over the course of the 6 days of program. So our main pillars are governance and multi-sectoral action, system response, and health intelligence and innovation. Basically, so as it is day 1, we'll be discussing on the action track 1, strengthening governance and policy frameworks. The day 2 program would be elaborating on multi-sectoral approach, whereas the other days will be under day 3 would be talking about creating resilience and strengthening health systems. Day 4, improving the management and control of NCDs. And day 5 would be sustained capacity building for monitoring and evaluation. Day 6 would be innovating research and development in NCD control and management. Thank you. Vinaka Vakalevu and Dhanyavad.